Hello and welcome back to another episode. My wingman Mahesh Kumar is not here today because he's relocated to Bali for the winter season. I'm really excited to be here with Lindsay Mumma, who is a pelvic floor specialist, but also a chiropractor, and works with postpartum women and also pre and postpartum women, but also the whole general population as well. So she has a wealth of knowledge. She has written several books, and she has also got a program that she does yearly, a holistic health and fitness program for women as well, which I'm very excited for her to tell us a little bit more about too. So over to you, Lindsay. And I'd like, if it was possible, I'd like you to be able to share with our listeners a little bit more about yourself and what you do.
Yeah, thanks so much, Abby. I'm glad to be here. I am, like you said, a chiropractor. So I was a high school athlete and I went on to play volleyball in college, but I don't think I would have been able to do that if it hadn't been for my chiropractor. I had kind of been through the gamut of the Western medicine model because I had low back pain and I was a high school athlete and I did a lot of extension biased activities. So I was a volleyball player. I was a cheerleader and I ran track and I did hurdles and long jump and high jump. And like every single one of those activities has extension in them. And so a 15-year-old female athlete with acute low back pain, she is most likely to have a pars defect, some sort of spondylolisthesis. And I didn't. And so no one knew what to do with me.
Oh, no.
And for about a year, I just kind of dealt with low back pain. And I would come home from whatever practice I had and lay on an ice pack. And I was taking Advil and Tylenol every day. And for a while, I actually was prescribed Vioxx before it got pulled off the market. I was on that for about 6 months. Didn't kill me, so thank God. But I kind of went through the ringer. You know, I had a bunch of specialists check me out and a bunch of tests run. And, you know, it was kind of scary because people were like, I don't know what's wrong with you. We can tell you're not making it up, because I was like a very competitive athlete. And so they got already that I wasn't making this all up, but they couldn't tell me what was wrong with me. And I saw a chiropractor that my friend had recommended. I'd actually seen a chiropractor and he didn't help me. And I saw a chiropractor that my friend had recommended, and she was, you know, at least 7 inches shorter than me and probably 30 pounds less than me. And I'm not that big of a person. And I was like, this little pipsqueak's going to do something. and she was like, oh, I can help you. And it was the first person who had said that to me in almost a year of searching for someone to be able to help me. And it was so relieving to just even hear that kind of glimpse of hope. And the stark contrast was that I had collapsed across the finish line in the 300-meter hurdles in just super dramatic fashion, as any 15-year-old girl can do.
I know.
And the following year, after I had seen my chiropractor, you know, and within a week, I was like, oh, this pain that I have dealt with is so much better. And within 2 weeks, I had no pain. And that was amazing to me. And obviously earth changing for someone who's, you know, just turning 16 years old. And so the following year, I actually broke the record in for my high school for the 300-meter hurdles, the same race that was like, you can't run anymore. Obviously, this is a problem. And so it was just such a huge difference for me. I was like, I want to be able to do this for other people. And so I, you know, went on to become a chiropractor. And so that was kind of how I got started into chiropractic. And my mindset was that I wanted to take care of athletes. And my husband and I had a long distance relationship for the entire time that I was in chiropractic college. So we met at the very end of my undergrad, and then I left for 3.5 years. Just a wonderful love story. But so we had kind of thought that we would wait a little while before having kids. But then I was like, you know what? My practice is just starting and I'm not that busy right now. It'll probably be easier to take maternity leave now than when I've got, you know, like a whole day's worth of patients.
Clients, sorry.
Yeah, right. And so so we decided a year after we got married that we would, you know, have kids. And I was like, well, wait a second. I was gonna max my back squat. Can I still do that when I'm pregnant? Because I don't know. There's not a lot of information out there about working out when you're pregnant. And I got pregnant in 2012, which now it sounds even foreign that people that people would scoff at working out during pregnancy, because, your doctor would recommend that you take a brisk walk here or there or whatever, but people weren't focused on strength training during pregnancy in 2012. And
No.
I had so many side eyes because I decided that I was like, you know what? I know that I feel healthier. I am healthier if I don't lose muscle mass right now. And if I continue to give myself this mental outlet for working out. And so I wanted to learn as much as I could. And gratefully, James Clapp and Marissa Cram had written the book Exercising Through Your Pregnancy, which actually came out in 2012. And it's a great book because what they did was study women like me. They studied, because there are ethical reasons why we don't study pregnancy very much, because let's try this intervention and see if everybody makes it. It's not really, it's not a good plan.
No.
And so but they studied women who were choosing to work out during their pregnancy. And what they found was the number of decreased side effects of pregnancy in general that came about with working out. And so I started collecting all of this information as much as I could, and comparing that to the groups who were not working out, and realizing how much healthier both the women and their offspring can be if they are maintaining active levels of movement during pregnancy. So my mindset kind of shifted from like, I want to take care of athletes, to I want to take care of pregnant athletes, because that's who I want to be. And as I was learning about pregnancy, I just kind of started sharing stuff. I'm like seeing a 28-year-old CrossFit male. I'm like, well, did you know that during pregnancy? And he's like, what? Why are you telling me this? Like, I just thought it was interesting. I thought you'd want to know. And so I started seeing a lot more pregnant women because I couldn't stop talking about the stuff that I was learning. And I got pregnant and I was being active through my pregnancy. So then people were coming to me with questions about like, hey, is it still okay for me to do X, Y, and Z? And we'd kind of workshop through some of those things and being intentional about moving during pregnancy. And so I kind of went on a little bit of a crusade. And then at the same time realized that we have it completely backwards, where we're like, oh, take it really easy when you're pregnant. And then in the postpartum time period, we're like, did you put your jeans back on yet? Because that's all that matters.
Yeah.
And
this is the thing.
Get right back to whatever activity it was that you were doing. And the stark contrast of how we handle pregnancy and how we handle postpartum from a cultural standpoint in the Western world is just a little bonkers. And so then that was sort of my next crusade. Was I was like, okay, this isn't right. We've got to do something about this. And so, began working with a lot more postpartum women. And in working with postpartum women, a lot of them were dealing with pelvic floor dysfunction. And I had been lucky enough to start studying dynamic neuromuscular stabilization when I was a student. One of my mentors was a DNS instructor. And so that's where I came across that. And, I have since gone on to complete my certification. I'm the only certified DNS practitioner in the state of North Carolina, which is where I practice.
Can I stop you just for a minute? And can I get you to explain what DNS is to the people who are listening? Because although I know what it is, they probably won't. So
yes. So I have been on this journey. So this is where like realizing there were so many pelvic floor dysfunction cases that were, coming onto my table. I actually had a lot of tools for this, but I wasn't entirely certain or confident in how to apply this to a pelvic floor that had just been stretched to max capacity, or to a pelvic floor post abdominal surgery, right? So with a cesarean section, the pelvic floor is still impacted. But gratefully, I was like, okay, I'm going to really kind of dig into the bottom half of this. So DNS stands for Dynamic Neuromuscular Stabilization, and it was created by Dr. Pavel Kolosh, and he is one of the most brilliant people that I've ever had the chance to meet. And I'm lucky enough that he's worked on me and just, I mean, it's like, he puts his hands on you and you're like, oh yeah, this guy knows what the heck he's doing. And he can palpate so much and he can see so much just because he's trained his eyes and his hands. And it's such a gift to be able to witness him treat people and just kind of watch what he does, and to see his level of pattern recognition, because the body tells a story of what it is that you've been doing and how you have been holding tension. And so Pavel Kolosh kind of took a lot of the thought leaders from the Czech Republic. So Prague is sort of like Mecca for manual therapists. It's just this place where all of the brilliant manual therapy minds have sort of come through or out of. And the Prague school isn't really like a place, it's kind of a school of thought. And so Vladimir Janda and Carol Levitt, and like even drawing from like Carlton Bourne and some osteopaths, and having these brilliant minds. Pavel Kolash was exposed to all of them. And even Ludmila Mojishova, she was a nurse, and she could look at a crowd of women and be like, you need to go and see your gynecologist. You have some gynecological issues. And
Yeah.
she could pick out based on, like, not even doing a like history and assessment. She could look at a person's body, watch them walk for 2 or 3 steps, and tell you if she had some sort of functional sterility.
Yeah.
And so Pavel got to see all of those people, and he was like, okay, the way that the body is designed to move is the same way that the body learned to move. So when a baby giraffe is born, they come out and they wobble a little bit and then they take off running. When a human is born, they come out and we're pretty helpless. That's because so much of our in utero development is toward making our brains really, really functional. But when we come out, we're completely dependent upon our parents in order to keep us alive. So there are so many of the primitive reflexes that actually begin to establish the first movements that are necessary. So the breast crawl, if you've ever been able to see one of those where a baby's born and they get laid on their mother's abdomen and can actually, even though they cannot technically ambulate, they can crawl to the breast and self-latch and begin breastfeeding. It's amazing. That is because of stimulation of the primitive reflexes. So if we take these primitive reflexes and we don't develop appropriately over them, we'll start to see a reverting of the normal human development more toward that infantile reflex pattern. So you see it in upper motor neuron lesion cases where if someone's had a stroke, they actually start to look like a newborn baby. And the same thing with cerebral palsy cases. So Václav Vojta was one of the leaders in this. He was a pediatric neurologist. And so when Pavel was seeing the work that he was doing with infants and sort of just putting all these pieces together of, okay, the body is this neuromusculoskeletal mover, and how we move is based upon what our first year of life and almost a year and a half of life really look like. This is how we form our physical joints. This is how we form our skeletal structure. This is how we have our upper thoracic curvature and our lower lumbar curvature. This is how we create our cervical curves. And this is how we establish appropriate stabilization. So he began studying this and then teaching other people. And he was, and now, you know,
so
he's been
to reflect this a little bit for people who don't know any of this is the fact that when we first start out, the first thing we do is we roll, and then the next things we do are pushing up, and then we've got our rocking and our crawling. These are all the movement patterns we're talking about. And so these are the ones that start to establish us for the curvature in our spine and for our locomotion pattern and our gait pattern later on in life. So these are all things we need to do in order to be healthy in our skeletal structure and our muscles when later on in life.
Yes, and the crawling pattern is actually where our brain developed the ability to have a walking pattern. It's also where our skeletal structure developed the ability to create our hip joints and our shoulder sockets. And so I don't know what it's like in Scotland, but here in America, the American Academy of Pediatrics actually took crawling off of their list of milestones that babies need to achieve. And my jaw hit the floor when I saw that. I was like,
there's a big thing. There's a big thing about, my baby just got up and walked. My baby was so proactive and it's developed
so advanced.
Yeah. It immediately, and I mean, I got up and walked. My son, I didn't know any of this back then. My son got up and walked at 8 months. He was walking at 8 months. He barely crawled. And I mean, I've got and I'm sure for me and for other women like me who didn't crawl, this has had a massive impact on both the way we stand and what happens to us postnatally as well.
Yeah, because if you get into an upright position and you're not yet stable, which is actually what happens in the postpartum time period, technically we shouldn't even be able to walk around immediately after giving birth, because our intra-abdominal pressure has drastically changed, right? So there's like 16 milligrams of mercury difference instantaneously of our internal pressure systems upon giving birth. And that's probably not an exact number because the studies of these are a little bit kind of wonky for testing actual pressure within the abdominal cavity during pregnancy and in the postpartum time period. But we have this massive, beautiful, wonderful space occupying lesion that is a baby in a uterus. And then all of a sudden we no longer have that increase in pressure, and it's almost like a vacuum where we don't have anything there. Our organs are trying to reorient themselves. We don't actually have enough stability to walk around. So then we start to create kind of external compression in order to keep us upright. And that's what young walkers who haven't had time to crawl and haven't given themselves the kind of like shoulder to opposite hip, anterior and posterior slings of support, and given themselves enough time of diaphragm parallel to pelvic floor. When they get into an upright position, they actually look like they're in a prenatal posture. They've got their abdomen forward. Exactly.
Yeah.
And so they're trying to find stability, but they can't quite find it yet. And they would actually find that
see
really well
this.
on the ground.
You see this in postnatal women who are doing far too much, far too quickly. They get into that thrust forward of the rib cage, the forward
anterior
really
pelvis tilt. Yep. The whole thing. And so when I realized, okay, I can just take everything that I know from DNS and I can apply it to pregnant women. I can take everything I know from DNS and apply it to postpartum women. And I started kind of like putting those things together in my mind, and then I could put those things together for a patient. And so I wanted women to understand. So babies are born with a diastasis of the rectus abdominis muscles. So their rectus abdominis runs right down the middle of their abdomen, but because they haven't actually started loading their abdomen in any sort of stabilization way, they haven't needed to have appropriate stability between their diaphragm and pelvic floor. They're not a giraffe. They didn't come out ready to move. The thing is, a giraffe is a quadruped. Humans are the only bipedal creatures who actually have all of their weight of the torso sitting on top of the pelvic floor.
Yeah.
So we have much more pressure going down onto the pelvic floor than any of our other mammalian cousins, right? So like even with any of the gorilla or monkey family, they're a slight tilt forward. So their pelvic floor is underneath of them, but it's a slight tilt forward. So it's actually a little bit more on their pelvic structure rather than on their pelvic floor. Yeah. So we have a huge amount of coordination that needs to happen in the first year. And if I can kind of explain to women, all right, during pregnancy, your body is going to change. You're going to recreate the same type of posture that you had when you were a newborn, and you couldn't really hold yourself up and walk around, but you're going to do it while simultaneously gaining 20 to 40 pounds, sometimes even more, ideally 20 to 40 pounds. But like you're going to be gaining weight in a way that isn't consistent with how you would gain weight if you just slowly took in more calories than you were getting rid of. And you're going to be having to work with a different hormonal cascade than what you're used to. Like there are so many things that are happening.
There's so many differences that's going on. So you've got hormones, you've got posture, you've got and then you've got it, depending on tissue type, much more laxity depending on tissue type as well. Yeah.
Well, and even if you have really good, strong connective tissue, right? You don't have any sort of connective tissue dysfunction leading up to pregnancy, you still have more relaxin in your system. And the relaxin is in the joints, it's in the muscles, it's in the soft tissues, it's even in your blood vessels. And so you have so much laxity in your system, your brain and your body are just looking for stability. But if we can kind of allow women to understand the stability that you have to be an upright person comes between your diaphragm and your pelvic floor. That's going to be changing rapidly during pregnancy, but it doesn't mean that it has to completely go out the window. We can actually continue to keep diaphragm and pelvic floor moving in sync together to give you enough stability to be an upright human. And then that is the absolute first thing that we have to do in the postpartum time period is simply return breathing mechanics of the diaphragm. So that's
working with the canister, working with the central canister.
Yep. And so in the immediately post-birth, a baby has a diastasis of the rectus abdominis muscles and they're peeing their pants. Yeah, and when I say to women immediately after giving birth, so do you, now this starts to make sense of like, oh, okay, this tracks. I currently, right, because at the end of, 36 weeks and beyond, 100% of pregnancies have a diastasis of the rectus abdominis. And people were, the pendulum swung in such a way where no one knew what a diastasis was. It was completely unknown. No one was talking about it. To then social media got a hold of it. And it was like a diastasis is the worst thing that could ever happen to you. And I was a little bit like, okay, we kind of got to maybe prevent this from getting as bad as it could. But realistically, if you didn't have a diastasis, then your baby would crush all of your major organs. It's kind of a good thing that you get a little bit of extra stretch in your linea alba.
Why we have that. That's why we have the linea alba, and that's why the relaxin allows that stretch. And it's not something to be frightened of. So a lot of women are really frightened frightened about having a diastasis recti after pregnancy. And it's that re-education that we're looking for, that diastasis recti is, it's just a stretching or a lengthening of the linea alba and the connective tissues, and it's something that we can draw back together again afterwards. It's not a design flaw, right. It's an advantage. Yeah.
Yes, and that's significantly more productive than if the weight of the baby was just crushing your small intestine, right? Like we actually need to be able to have our organs move and be able to have our abdomen distend in such a way that we can accommodate that there's another person living in our body. It's really truly a marvel of humanity. It's incredible. And birth is such an incredible miracle that even though it's an everyday occurrence and all of us got here via that, it's still
we did.
Absolutely miraculous to me. And I get absolutely fascinated just even thinking about the number of things that have to happen in order for a baby to be born. It's so amazing.
I know, and all the history behind it as well. But so, how we all got here. But so what advice would you give a woman postnatally? What would your advice be if she was wanting to get back to exercise and she was wanting to get back to being active? And we now know, and I know that you and I are on the same page rather than playing a devil's advocate, sorry Mahesh, that it's really important that we do get back to activity. But how would you recommend a woman does it in a safe, not so much, safe way, I guess, a safe way and a proactive way. Yeah.
So I think maybe the reason why you were trying to find another word for safe is because you and I both understand there's not inherent danger in acting like above your threshold in the postpartum time period. It's not really a huge risk. You're not going to keel over because you did too much activity. What we're talking about is neuromuscular health and neuromusculoskeletal health. And so if we don't have enough adequate stability and we start doing things, then we're going to be more prone to things like tendinitis and tendinopathies and more like chronic loading issues than if we actually take our time. So one of my good friends, she's a pelvic PT and she's also an eating psychology practitioner, and she always says slow is fast. And the reality of it is, if you're so quick to return to activity in the postpartum time period, it will actually take you longer to fully recover. If you take it nice and slow, you will much more quickly be at a level of fitness that you want to be, rather than giving yourself a bunch of hurdles in the middle that you have to overcome. Because if you start doing too much in the postpartum time period, you don't have adequate core and pelvic floor stability, then you're at risk of injury and you're at risk of creating these kind of chronic conditions that you just don't need to be dealing with. And I think a lot of people, they have the image that having a baby just kind of like wrecks your body and then you're never the same again. Well, that's probably just because we have so many things that are working against that initial healing period where we're not quite able to take our time in fully recovering so that then we can have a full recovery. So when people are walking around partially recovered and then they get pregnant again, like that's a recipe for disaster. So sorry, I took that for a very long tangent.
No, that's
to answer your actual question.
There's clearly something very passionate about it. It is, I mean, people do go back far, far too fast. So in the UK, and we'll come back to my actual question in a minute, in the UK, women are told at 6 weeks, so they have a 6-week checkup. And at 6 weeks, their doctor doesn't really check them. They check the baby, they check to make sure the woman's not depressed. And then the women just presume, because they've had their 6-week check, they can go back to doing what they were doing before. And if, for example, you were me, you would go back to doing your 100 sit-ups a day and your X amount of press-ups. And that is very... Now I understand how not okay that was.
How very deleterious that was.
So not okay that was. However, this is still what a lot of women, so this is the reason we're doing all these conversations is to make women aware that there are positive ways to get back to exercise. And perhaps it's not doing exactly what you did before you got pregnant and exactly what you did before you went to your PT and said, hey, I'm pregnant, what exercise should I do during pregnancy? And they said to you, you shouldn't exercise during pregnancy, because that was the advice I got. So I know. So, so what would you recommend women do post? So just a thing that you might suggest to one of your clients who came post, who perhaps was active prior to pregnancy, but then hasn't done anything over the pregnancy period.
Okay,
Because
so
she's been told, like me, don't.
don't work out.
Yeah, don't
So
work out.
regardless of their activity level during pregnancy, the very first thing that I have my patients do is breathe. And that sounds so silly. And this is why I feel like I've been fighting a little bit of an uphill battle, because breathing is basically one of the pillars of DNS. So I started learning this stuff when I was a student. I've been talking to all of my patients about it since I've been in practice for almost 13 years. And everyone's like, yeah, I've been breathing. I do that. That's a thing that I do. I'm like, yes, but the way that you're breathing is actually contributing to the cervicogenic headaches that you have. It's contributing to the low back pain that you have. It's contributing to the failed load transfer of your gait cycle. And all of these things are truly impacted by the one activity that most people are doing 12 to 16 times per minute.
Per minute.
So if the way that you're breathing is by mouth breathing and taking a big breath up into your chest, you're actually setting yourself up for disaster, because that signals to your brain that you're completely stressed out. Stress was built to actually help us survive, but not help us thrive, because we didn't used to have to consider thriving, because the only thing that mattered was survival. Well, now our society has advanced in such a way that we have the potential to survive very long periods of time. But being in that constant state of like, I'm just surviving, is not really a great way to continue living. So if you breathe up into your chest, you're breathing with your secondary breathing muscles. Well, your secondary breathing muscles, like your levators and your scalenes, these are meant for helping you to expand your rib cage a little bit more when you have already reached full capacity using your diaphragm and intercostal muscles. So if you're only using your secondary breathing muscles as your primary breathing muscles, then your brain gets the signal that you must be so fatigued in your primary breathing muscles that you've been under serious stress for a really long time period. And stress physiologically to your brain is not traffic, and it's not your mother-in-law. It's a tiger that's like ready to kill you. And so if that's the way that you're breathing, you're telling your brain that you don't have time to worry about cellular regeneration. You don't have time to worry about soft tissue healing. You don't have time to worry about down regulation of your autonomic nervous system, because there must be a tiger nearby. Otherwise, there's no reason why you'd be breathing like that. So that, first and foremost, is super important. But then if we actually take the mechanics of it, where when the diaphragm lowers, so the diaphragm's sitting in the rib cage, and when that lowers, that's going to increase intra-abdominal pressure. Every single breath that we take increases intra-abdominal pressure, the pressure between our diaphragm and our pelvic floor. It's ideally a closed pressure system. So when the diaphragm lowers, the pelvic floor is going to lower a little bit. And when the diaphragm raises, the pelvic floor raises. Now, the title of my book is Your Pelvic Floor Sucks, which sounds like I'm just being a jerk. And a little bit, I sort of was, I'll be honest. But because I was so tired of hearing people say that they just were dealing with the fact that they had pelvic floor dysfunction. And I'm like, no, your pelvic floor sucks right now. And are you willing to do something about that? Because you can. You don't have to have a pelvic floor that sucks. The other part is, the only thing that people seem to know to do with their pelvic floor is a Kegel.
Yes.
And it's
so
not
I was
even
going to come to the Kegel, because women.
Of course, we're going to come to the Kegel.
women in the UK, and women that my clients, and my colleagues' clients as well, regularly, what they get given at their 6-week checkout, what they get given at the hospital, is they get asked if they're doing their Kegels.
Yes.
So, Lindsay,
could
you explain a little bit why this is maybe not the most
yes,
adaptive thing for them to be doing for their bodies?
It is a very good short-term adapter. And so that's why we're sticking with it, because it's just like breathing up into your chest. For the short term, that works, right? It gets the job done. You squeeze your pelvic floor, it's not going to leak. Yeah. Unfortunately, it's not a sustainable strategy. The other part of it, and I shared this in my book because I just think that it's interesting. A lot of people, like, you don't really think of why it's called a Kegel or whatever, but Dr. Arnold Kegel is the one who came up with this. And what he discovered was that there wasn't really good coordination of the pelvic floor muscles in his postpartum patients. And so he actually inserted a manometer and was testing the strength of these muscles and giving feedback. So it was actually more like a biofeedback thing that you might
Yeah,
run
it's
into
more
with the
like a
pelvic
Kegel
PT.
8. So more like
Yeah,
a Kegel 8 that you've got an app for that can give you biofeedback about what's going on with
right.
your body.
Do you
It's
have
like the
tension in your
first
pelvic
Kegel
floor?
8.
If you do have tension in your
Yeah.
pelvic floor, then are you able to relax that tension in your pelvic floor? And when I say contract your pelvic floor, can you actually do that? Like, do you have the connection between your brain and your pelvic floor muscles? But it's the most unimpressive thing that we can do with our pelvic floor, which again goes back to your pelvic floor sucks, because that's all people know is how to suck it up and in. And that sucks. It's really just not impressive. If you ask any trainer, any manual therapist, any PT, any chiropractor, any MD, doesn't matter who they are, if they know anything at all about any sort of movement, and you ask them to give you at least 3 exercises for the bicep, they could do it. If you ask them to give you at least 3 exercises for the pelvic floor, they cannot. The
Yes.
only thing anybody knows how to do with a pelvic floor, which, mind you, the bicep is 2 muscles. They do one activity this way and then lengthen this way. The pelvic floor is multi-layered and multi-directional. It has so many functions which change with every single step that we take and are impacted with every single breath that we take. The only thing that any personal trainer or any PT or any chiropractor knows how to tell you is to do a Kegel, a concentric shortening of all of these multi-layered, multi-directional muscles. That's the only thing we know how to do. Come on.
Yeah.
So as you can tell, I get very excited about these things, but it's frustrating to me, and I think it's because it's a personal area. And so this musculoskeletal tissue, like anywhere else, well, if you needed to rehab your shoulder, we'd have no problem talking to you about your supraspinatus or your teres minor. We'd have no problem having those discussions. But for some reason, we're not talking about the pelvic floor because it's inconveniently located
And
musculoskeletal
also,
tissue.
if we were to rehab a shoulder, we would have lots of different movement patterns that we would give the shoulder, because
Yep.
the shoulder has lots of different movement patterns.
Yep.
And it's got lots of different muscle connections to lots of different parts of our body. I think what gets overlooked a lot, and a lot of the people listening perhaps don't know, is how many connections the pelvic floor, the levator ani muscle itself, has to the rest of the body. And so when we're rehabbing through breath, like you were talking about, and looking at using breath in the postpartum period, how, instead of breathing up here, how would you suggest that?
Thank you for getting me back on track, Abby.
How would you suggest that that our ladies would breathe? What if this is not a great breath? And this might be the breath pattern they've been using in late pregnancy because
Yes.
they felt really squeezed
Because
up.
they've got a baby up underneath their rib cage. They have to figure out some way to breathe.
This is where they're stuck breathing.
Yeah.
And they're perhaps stuck in a flare of their rib cage. What would you suggest for them to change that breath so they can start working with their canister in a really positive way?
So one of the first ways that I have most people begin breathing intentionally is to just lie down. When you lie down on your back, it automatically gives you the advantage of not using your diaphragm to hold you upright. So most people are really not using their diaphragm well. You know, they're only partially allowing the diaphragm to lower, and then the rest of the work is done by their secondary breathing muscles elevating their rib cage. The diaphragm actually expands the rib cage, and it's meant to be held in place by the scalenes. It's not meant to be elevated by the scalenes. So the diaphragm lowers, therefore the abdomen actually has to expand. And this is one of the challenges, because immediately after giving birth, most women still look like they're pregnant. So then psychologically, from a cultural perspective, you know, we're just expected to put the same jeans back on, and everyone's wearing leggings. So I don't even know why that matters, but we're just expected to get back into our pre-pregnancy jeans as soon as we had a baby. And a lot of women have a hard time with that. So then they begin drawing their abdomen in. Well, the rectus abdominis, which, mind you, has just been separated through stretching of the linea alba, and also has kind of like intermuscular stretching long ways. So now those muscles are resting further apart in such a way that their abdomen is protruding forward most of the time. After my first pregnancy, I was like, no, I don't look pregnant anymore. I just look like a little looser. After my second pregnancy, I was like, oh, yeah, I look pregnant. I look like I'm like 6 months pregnant. So, and I was doing all of the appropriate things But that's just my body's adaptation was I still looked like I was pregnant. Now, I knew enough to not suck in my abdomen because I knew like, okay, these are tissues that have to heal. Well, you wouldn't try and suck in the swelling on your ankle after you had an ankle sprain, right? Like these tissues just need a little bit of time to heal. So in these first 6 weeks postpartum, one of the best things that you can do is simply lie down, allow your diaphragm to begin to lower itself. So if you're lying down and your head's up here and your diaphragm is here, when you take a deep breath in, your diaphragm lowers, your pelvic floor lowers, your abdominal wall will also expand. So 360 degrees of expansion
All the way around.
all the way around. And when you
Yes.
do that, you can actually create, and it's such a wonderful feeling for women to be able to feel their paraspinal muscles, so the muscles on either side of their spine, finally relax. Those muscles will stay on if your rib cage is elevated in the same position that you had in late pregnancy, that a lot of women go back to in the postpartum time period because they're trying to suck their belly in and they're trying to not look pregnant anymore. Well, then as soon as they do that, they change the way that pressure is hitting their pelvic floor, which then causes them to have to create more tension in their pelvic floor. And now we have tension in the back, tension in the abdomen, tension in the pelvic floor. We have a lack of excursion in the diaphragm. It's a disaster. And this is how most women are walking around. And then because this is the strategy that they're using, this is how they build their strategy moving forward.
Yes.
And they just continue to perpetuate this dysfunction because they don't know a different way. So if they actually intentionally 4 times a day take 10 breaths, first of all, no one is worse off for taking 10 breaths on purpose 4 times a day. If you take 40 breaths throughout your day that you were aware of, you are now a more patient person. You are now a more compassionate person. You are a kinder person, right? Because you have just returned to the present moment. And when you return to the present moment, your life exponentially gets greater because it's the only moment you have. Thanks for coming to my TED Talk on existentialism. But
so what we're looking for women to do in the supine is lying down on their backs. Would you say semi-supine or fully supine, Lindsay?
If they're comfortable, fully supine, absolutely, because I just want for them, the diaphragm functions in breath, it functions as a sphincter, and it functions in posture. And so if they're lying down, we can take the postural function of the diaphragm out. Ideally, the sphincter function is working. They don't have a hiatal hernia. And now we're just mainly focusing on them using their diaphragm for breathing. And because the diaphragm, it's a smooth muscle, but it's still a muscle. So we can exercise smooth muscle. And so oftentimes when they take a full deep breath and they allow their rib cage to expand and they allow their abdominal wall to expand, they'll feel a little short of breath because they're like, wait, like it's almost a shaky breath to get their diaphragm fully expanded. The same way that if not immediately postpartum, they were to pick up a heavy deadlift, their muscles would be shaking because this is something new for them that they haven't been able to do before. So this is new range of motion training for the diaphragm. And then it's also building up capacity of the diaphragm. Once we have a breathing pattern established that allows them to feel relaxation of their paraspinal muscles and create stability 360 degrees around their abdominal wall, then we can actually start training them to pressurize intentionally, which is utilizing intra-abdominal pressure to have stability. Because if we don't have pressure, we can't have appropriate tension, and then we'll create inappropriate tension. So that's where we get the paraspinals.
What would be their next step, Lindsay, then after they've done the 360 breathing supine? So they've done that so that's from birth till when, would you suggest?
So birth until about 3 weeks, I would say, in a vaginal birth with no complications. The 3-week mark is like completely arbitrary, I'll be honest. And that mark gets further away if there were interventions during the birth.
So like forceps, vertuous,
even an epidural, right? So if there's an epidural, well, now you have scar tissue right at the posterior attachment of the diaphragm. And that scar tissue creates a fissure. And that fissure of scar tissue actually disrupts all of the fascia in the area, including the diaphragm and the posterior abdominal wall. So any intervention actually lengthens that initial period before we'll start to do intentional movement. If there are any prolapse symptoms, if there were perineal tears, if there was, like if the baby had to go to the NICU, right? So there's just like an immediate stress in the postpartum time period. Then we're pushing that back 4, 5, 6 weeks before we begin doing intentional training. Spending that time just breathing is actually huge training. It's huge training. You're also completely sleep deprived. You're nutrient deprived. You just had a massive change in your center of gravity. You're still trying to find like where your feet, your knees, your hips, your shoulders, like where you are in the world. So spending time breathing gives you that focus right in your core, like in the absolute center of your body, which is going to be able to hold you upright. Or it's not, and then you're going to create an external compression strategy that's really not going to serve you well long term. So once they, at about 3 weeks in the
So it's having the patience initially to go, I've had massive
Yes.
trauma to my body, and I'm going to take time to use the breath work to, one, repressurize my system properly, get my canister functioning, get the relaxation through my paraspinals, really start healing the tissue. And then once I'm at that stage, depending on how long that's going to take for me, so tissue starts to heal within 12 weeks. It takes a long time. You know, it's not a quick fix.
No, not at all.
At that point, while they've been breathing, they've also been calming their nervous system down and working with their nervous system. So it's all about bringing them out of trauma, back into regulation. And once they're in regulation, what comes next?
So I have a postpartum rehab program, and that is, it's 6 weeks long. And honestly, it would be a year long if I thought anyone would actually buy that. But I want for twice a week for women to be intentionally moving. The classes are about 45 minutes long. And what I do is I introduce movements that we see developmentally in the first year of life. So things like lying on your back and now just pick one leg up off the ground and notice what happens in your core when you do that. Because if you pick your leg up and you don't actually have stability in your torso, then your lumbar spine will immediately turn on and you'll arch your back. Yes. And so then that means that you're overutilizing your psoas muscle. So you could go and see a wonderful massage therapist and get that psoas stripped out every other Tuesday, but it's not going to make a difference if you keep telling your brain that every time you lift your leg, you require your back to extend into further of a lordosis, arch your back, and that you're overusing your psoas muscles in order to just pick your leg up, which people don't often lay on the ground and pick one leg up, but they do bring their hip into flexion every single time that they take a step.
Every time they take a step. And also lots of women go back to Pilates and exercises like this postnatally, where they are required to pick their leg up off the floor for a single leg.
I think that's a gentle way of returning to movement. But
if there's any arching of the back, then perhaps they're not ready for that. And maybe that's something for our listeners to take on board as well, that perhaps if they go back to a Pilates class postnatally and they are doing something like a single leg lift and they do find themselves arching, that perhaps that lifting the leg off the floor, maybe they need to spend longer thinking about the movement pattern.
How do I pick my leg up without my spine moving? And the immediate response is actually to create expansion in the abdomen. And one of the easiest ways to feel this, so if people are just listening to this and they want to figure out, okay, what is this lady talking about? Because pressurizing the abdomen sounds like it's a hard concept to really understand until you feel it. So if you're just standing there and you think, okay, I'm going to stabilize my core, and I'm putting that in air quotes on purpose because a lot of people, when they stabilize their core, they just suck their belly button toward their spine, and they've been taught to do that. So they think that that's the best way to do it. Well, if you do that and you have someone just lean into you, you will fall right over. You cannot stand upright if that's how you're stabilizing, because it's not actually stable. So if then instead you just kind of reset your system and you ask that same person, hey, can you just try and nudge me over the same way you just did? And I'm just going to think, I don't want you to push me over. And what your body's response is to actually lower your diaphragm, expand the abdominal wall, create eccentric, which is lengthening contraction, which that's confusing because I'm saying lengthen and contract at the same time. But an eccentric contraction is a lengthening contraction of the abdominal wall, which is giving me stability. And then I'm not nearly as easy to push over. And I think, we could just stop being such pushovers if we stopped sucking our belly buttons to our spines.
That's also something that occurs when we breathe. So for the people who are listening as well, if you were actually to do a 360 breath with your rib cage opening and to put your fingers into your abdominal wall, you can feel that stabilization because it's eccentrically contracting, and then we have the contraction back in again of the deep transverse when we close our ribs or allow our ribs to close. So when the diaphragm moves down, we have this great loading. And I do weird stuff with that. So
we'll do getting them to just lift one leg up off the ground and then start to do that with some intention, right? So a good friend and colleague of mine, Dr. Erica Bolin, she is a chiropractor as well. She's also a certified DNS practitioner. She's also now a practicing midwife. She just loves birth and she couldn't get enough of it, so she actually went back
She
to
just
now.
kept going.
Yeah, so her practice is now a birth center. But she had gone to Prague and she was like, we are completely screwing up all of this pelvic floor recovery stuff for women postpartum. And so she created what is called the functional progression. And it's just 4 exercises that kind of mimic the first year of life. So we'll teach the functional progression in the postpartum rehab course that I have. And then we'll also teach movements that we see developmentally in the first year of life, which we call it a shin box in DNS, which is like double hook position, if you know cheerleading moves, but like one leg in front and one leg behind, and teaching women how to get up off the ground from that position, because that's a place that they find themselves in frequently. So it's a hip hinging movement, which is really great for the pelvic floor. It's also really great for returning activity to the glutes in the postpartum time period. And it helps them to be able to be, okay, I'm on the ground with my baby who now fell asleep and I don't want to sit here. I'd like to get up and move. So here's how I'm going to get up without using my hands. And then, when we even look further into longevity, the ability to get up off of the ground without using your hands is a predictor
really
for how
important.
long you'll live. Right.
Yeah.
So if you're thinking about, do I want to be a healthy 80-year-old? Well, postnatally, you can be training for that very intentionally. And so basically the postpartum rehab course is me teaching people the principles of DNS and also giving them a little bit of postpartum education, because, we take childbirth education classes so that we learn, because we don't really know anything about this. We got to kind of figure it out, I guess. So we take education classes in order to inform ourselves. But in the postpartum time period, there's no postpartum education. It's just like,
no, there's just the pre.
Sink or swim, sister.
Yeah, there's a pre, and then there's your baby. See you later.
Yeah. And then you get that 6-week checkup that you were talking about. And just like you said, 6 weeks postpartum it's like we're looking for red flags of severe depression or postpartum psychosis. We're looking for signs of infection. We're making sure that no one's dead.
Yeah.
But once again, we're just checking for survival instead of checking for thriving. And I think we can do a heck of a lot better. So if at 6 weeks postpartum, that's when women decide that they'd like to begin activity, I would invite them to, at that point, start breathing on purpose. I know you've been doing it 12 to 16 times a minute, but do it on purpose and see what happens. See if you can give yourself a better stability and simultaneously downregulate your nervous system, because the downstream effects of that are huge. And if you can take a sleep deprived woman and give her a little bit less of that kind of frantic state, I think that makes for healthier children as well. Because we have these ideas about birth order and how, the firstborn is like this and the second is like this. And if you're third in line, it's this. I think it's actually just a complete reflection of the parents.
Where they're at.
Yes. The first time you have a child, you're like, oh, I'm going to break this and I'm very nervous. And then your second kid, you're so much more laid back because you're like, well, I did it already.
And that makes a massive difference to your pelvic floor as well, which is why 100%. Quite often people say, after my second child, there wasn't any real change. I still have the same prolapse I had, or, because they're not upregulating their nervous system.
They're not creating excess tension in their system.
Yeah.
And I mean, I think it just makes such a big difference in how they're then able to heal, because if you're stressed, your brain can't heal. And the situation of postpartum is stressful, right? You're trying to figure out a new language. This baby does not speak what I speak, and I have to learn this new language, but I also am not sleeping and I don't really know what's going on. I don't have a lot of direction. It's a very stressful time period for people. And so if you can remind your brain, okay, there are things going on, but I'm safe. And that's the message that you send when you do intentional breathing. I mean, it just makes such a huge difference for people.
So the biggest takeaway from this is, one, that it's all about functional patterns when we come to rehab. And a lot of your course is based on that with the DNS as well. And that breath is the first thing we should really be focusing on, so we can reestablish the canister. So we get the proper intra-abdominal pressure between the diaphragm and the pelvic floor. And it also helps us to downregulate our nervous system, which makes us feel safe, which again aids healing, because we can't heal when we're in a heightened state of fight or flight. The tiger is in the room.
Right, exactly.
Yeah. And so how do people, if people want to get in touch with you or do your course, how would they get in touch with you to do your course, Lindsay?
Yeah, so This is very strange to people, but I'm not on social media. So I used to have accounts and you can find me there, but you won't actually be able to connect with me. I just put a whole bunch of information on there, so I didn't want to delete them. But I got off social media almost 4 years ago, and it's really nice. The real world is actually a great place.
It
The
is a
internet
great
is
place.
kind of terrible. But so you can't find me to like chat with me there, but you can go to my website. So Triangle CRC, the shape, and then CRC as in Triangle Chiropractic and Rehabilitation Center. That is my website. So trianglecrc.com. You can also just go to lindsaymumma.com, and that will kind of pop you onto my website.
Yeah.
Yourpelvicfloorsucks.com is another one of my websites, because that's my book, and my courses are all on my website, and so you can find those. I also teach chiropractors, so I teach continuing education courses. So
For
I'm actually
chiropractors as
I'm
well.
coming toward you. I'm going to be in the Netherlands this week. So
Nice. So if
yeah,
somebody was a chiropractor who's just had a baby, who's listening to this, who's really interested in what you
yeah,
do, then that's also another way for them to connect with you, is to do
yeah.
training with you as well.
Yeah,
Um,
I have a lot of chiropractors and PTs who have taken my postpartum rehab course because they just wanted to learn, how is it that you would do this? Like, how, if I were to do this with patients, how is it that I do it? I'm like, take the course yourself, feel it,
and
see what changes you
there's
notice.
I'm
Yeah.
already interested.
Mhm.
I'm going to say thank you very much
Yeah.
for being here. And thank you so much for taking your time to talk to us as well, Lindsay.
Yeah.
It's
It
been
was really
strange
great to
without my
chat with you.
it's been wingman doing his curious thinking.
Well,
Uh,
if he has questions for me, Mahesh can he can get in touch with me.
yeah, sorry. Our listeners know how to get in touch with you as well. So it's all great. I've covered all my bases.
You did
Um,
great.
Cool. And I'm gonna stop the recording just now. He can edit it
Okay.
out, and I'll just say goodbye properly to you as well.
Awesome.